FM 104 KUOO Campus Radio and the outfield with your love. Good morning, Becky Thoris and Midday Okoboji. Time for Becky's Business Beat. And joining me today, Nikki Steen, Program Director with the Hyperbaric Wound and Healing Center in Windham, Minnesota. Hi, Nikki.
Good morning, Becky.
We had a little crackle there, but I think you're on the line. Oh, good. Well, you have all kinds of different wounds that you treat and a lot of different methods that you use, but the hyperbaric healing chamber is really a fantastic way of healing difficult wounds, isn't it? Can you explain a little bit what it is?
Yes, a hyperbaric chamber is an acrylic. It's a clear chamber that patients go into. While they're in there, we're able to pump in 100% oxygen under pressure. And when that oxygen gets into the body, it not only gets into the cells, it gets into the bloodstream, past the bloodstream into the plasma, and it saturates the body with oxygen, which we know will help people heal. It gets all of those mechanisms up and running where it can help grow new tissues and new bones and new tendons and new blood supplies. All that will help from the inside out to get people's wounds to heal.
It's really quite amazing. How long is someone in the chamber when they are doing a treatment?
Each treatment, we say the appointment takes about 2 hours. It takes a little time for them to be evaluated and get ready to go in the chamber. And then they're in there for about an hour and a half, about 90 minutes, and about 15 minutes to take them out of the chamber and get ready to go on with their days. Every patient's treatment is just a little bit different. It really depends on what type of wound brought that patient into hyperbaric therapy.
Quite amazing. And what kind of wounds can you treat with that therapy?
We can treat all different things with hyperbarics. We use it a lot for our diabetic population who has those very deep wounds. We can also use it for something we call soft tissue radionecrosis or osteoradionecrosis. And basically those are great big words to say someone who's been through cancer treatment, who's had radiation, that sometimes there's wounds from within. And we can use hyperbarics to get inside of those wounds, to get inside of the body and help the wounds that were caused by the radiation heal.
People can come directly to you. They can be referred, but they can just contact you directly if they want to come have an appointment and explore their options as far as treating wounds.
Yes, absolutely. We are open Monday through Friday, 8 to 4:30, and patients can self-refer. You can call us at 507-831-0686. Patients also come here by referrals from their primary doctors, from their surgeons, from their orthopedists, from diabetic educators, physical therapists, all different ways that patients can come and see us. But yes, of course, patients can call us directly and make their first appointment, make their first step in getting their wounds healed.
WindhamAreaHealth.org is the website also, and you've got a couple of events coming up next month. You're going to be focusing on diabetes.
Yes, next month on November 2nd, we are going to be at Hy-Vee in Windham from 10 to 2 for a large diabetes event where we're going to learn about diabetes and diets. We're working with our diabetic educators and nutritionalists. And then we also are going to participate in EGCO's health fair coming up the middle of November. So we're very excited to spread our word about peripheral artery disease and wounds and what people can do in the workforce to prevent some of these things from happening.
Well, that'll be something to chat about here in the next couple of weeks. And thank you for sharing all that information with us, Nikki.
Thank you so much.
There's Nikki Steen, Program Director, Wound and Hyperbaric Healing Center in Windham, WindhamAreaHealth.org. Lots of great information there. It's Becky's Business Beat on Campus Radio, KUOO.